So introduce yourself to us and tell us a little bit about your role and a brief history of your experience as a speech pathologist.
Hi, thank you. My name is Michelle O'Laughlin. I've been a speech pathologist for over 25 years, and I've worked in a variety of settings, including schools, clinics, university setting, and currently I am providing teletherapy services for elementary schools and middle schools.
Tell us a little bit about your role as a CF mentor with Med Travelers and what some of your responsibilities are and what that looks like.
As a CF mentor, I work with a brand new professional, somebody who is getting out of graduate school and beginning her journey on the clinical fellowship year. That's her first job. So my role as a mentor is to provide weekly connection and guidance throughout the clinical fellowship year. So what I'm trying to do there is not just, it's a variety of things. I'll answer questions about anything from how to deal with other staff members, how to organize your schedule, how to schedule students, working with caregivers, advocating for themselves. And it's a person that they can always turn to that's outside of their school district that will help them to work through some of the issues that clinicians will experience. And sometimes that's just how would you address a specific issue from an IEP, working through paperwork. Sometimes it is how would you approach this child who has an R disorder. So it can be anything that person is experiencing in their first role.
Tell us a little bit about that relationship that the CF mentor has with the CF themselves.
The CF and mentor relationship, I think, is a special one. I think we meet prior to the CF even beginning her journey and talk about expectations, talk about, answer any questions. And I like to ask my CF, what do you need from me as a mentor throughout this journey of yours to be successful? And often they don't know yet because they're not experiencing yet. But I say we're going to work on it and through it together. I want them to look at me less like a supervisor like they had in their university setting and more as a colleague with a lot of experience. So whatever they're going through, I've most likely experienced or managed the situation. And I think that the constant interaction, the weekly connection really helps that relationship to grow because we learn to trust each other.
And it sounds like important part of that relationship is the CF letting you know what they need.
Absolutely. And it's good practice for them because I'm a safe person that they know is behind the scenes in their corner, invested in their success. It helps them to figure out how to advocate for themselves in their work environment.
What made you decide to be a CF mentor?
I have a lot of experience mentoring and supervising because of a previous position that I held at a university as a clinical assistant professor. So I had graduate speech-language pathology students that I worked with daily for years, and I loved that relationship. And what's exciting to me about having a CF and being a mentor is that those individuals have graduated. They've been vetted by AMN. And so I know I'm already getting somebody that is really excited to work and get going in their career. So I feel like I'm giving back to my profession. I'm investing in the next generation of speech-language pathologists and hopefully helping them benefit from the years of experience that I have.
And what would you just say because I know we're all stretched thin, what would you say if somebody said, I don't have time? I just don't have time.
I feel like we make time for the things that are important to us, and I'm in a position now professionally where I'm able to make the time to give back in this way and work with students. And also, I am very organized and scheduled, so if it's I schedule it into my week, and then I can always make sure that it gets done, and I plan around it.
What's your favorite thing about working as a CF mentor with Med Travelers?
My favorite thing is developing a connection and friendship with a CF. I love working with younger people, and the opportunity through AMN to coach, to guide, to mentor, to be there for somebody who's in our profession is exciting. It's a great opportunity. It's wonderful to make that connection. It's wonderful to be helping, and to know that I'm making a difference in another professional's life.
What advice do you have for somebody who's about to begin their clinical fellowship?
I advise all of my clinical fellows to have a sense of curiosity, to take one day at a time, and not look at the entire school year in one big bite, but really flow through, and figure out who you can work with in your district, as well as myself, to learn what you need to learn to be successful in your role as a speech-language pathologist. Be open, be curious, and communicate. Use your skills to connect with your colleagues, because they will be your best friends in your new setting.